Welcome back to Bread and Butter Primary Care. I'm Dr. Stokes. Glad to have you here today. It's Friday. I don't work on Fridays, and so recording this during the day, a little bit different scenery, and excited to talk to you guys about more about history. And so I've done a couple little mini lectures, or whatever you want to call these, on collecting a good HPI, getting a review of systems, and so this video is entitled Other History and When It's Important. So specifically talking about some of those kind of more chronic history elements that you want to have in the chart and when it's going to be important to have those. So that's like the past medical history, the past surgical history, the social history would be the three main components of that in the family history. Sorry, so four main components. So past medical history, social history, past surgical history, and then the family history. So these are elements of the patient's history that may not be pertinent to why you're seeing them on a given day, but are important to have in case when they do become important. And they become important in a couple different ways. One is for diagnostic mysteries. So if you have something going on and you're having a hard time figuring out exactly what's going or what's happening, having that family history, knowing more about their social history can really come into play and help give you some insight into what's happening. The other one is for screening, especially family history. So knowing a patient's family history is going to be important as far as when do you check a colonoscopy, when do you check a prostate lab exam, and those types of things. And so those are the two main things. And so these histories are usually something that you definitely want to have these on all your patients. When you're having a new intake, they're coming in for the first time, you want to take that little bit of extra time to go through those things. Usually new patients have more time. My patients, for example, are usually scheduled at 15-minute appointments, but a brand new patient who's never been here before gets 30. And some of what that extra time is for is time to talk about these things. There are also history that are sometimes collected by staff members. And so oftentimes my medical assistants on the intake, when they get the vitals and that type of a thing, they will get the family medical, surgical, and social history. So that's nice and convenient because before I even go in to see a brand new patient, I've already been able to review those things. And so that's oftentimes a really good way to go. And so family history, pretty straightforward. Usually what I'll ask people is, are there any diseases that you know of in your family, especially in your parents and siblings? The further out you get in a family, uncles and aunts and cousins and that type of thing, then the less applicable it is to the individual. The most important family history is the one that's first degree, so just one step away from the individual. So like I said, parents and siblings. Grandparents are also pretty good because they're two steps away, but they're still in just that one line. And so I'll usually just ask people any diseases you know of in your family. If they say nope, none at all, then I'll oftentimes follow up and say, how about things like high blood pressure, diabetes, and any type of cancer? Just to kind of help trigger their minds to make sure they didn't just not think of something. So that's family history. Past medical history, I'll usually ask people, have you ever been told by a doctor that you had something or needed treatment for something on a long-term basis? So if you just ask them, well, have you ever had anything before? Or sometimes they'll be like, well, yeah, I had a cold, a couple months ago, and this one time I had strep throat. And those aren't really the things you're looking for. You're looking for conditions that they've been diagnosed with that would require chronic management. Again, if they say nothing, sometimes you can follow up. Have you ever been told that your blood pressure's high? Have you ever been told that your sugar's high? Have you ever been told anything like that? Have you ever been told that you should be taking a medicine? So that's a good way to get the past medical history. Surgical history is pretty straightforward. Have you had any surgeries? And if so, what? It certainly can be helpful in future diagnoses. If you have someone coming in and they're having abdominal pain with eating, but they've had their gallbladder removed, then that changes your differential and what you're going to be considering on the top of your list. And so there's a surgical history. Of these four other histories, one of the most important ones is certainly the social history. That would include things like smoking, alcohol use, diet and exercise, and other drug use. So those are the four big things on social history. So you usually ask people if they smoke, and if they say no, have you ever smoked? If you do, you drink any alcohol, and if so, how much? Any other recreational drug use now or in the past? And then tell me a little bit about your lifestyle. Do you pay attention to what you eat? Do you exercise on a regular basis? Or do you tend not to have that be, something that you actively think about on a regular basis? And, you never know how honest people are being. I know that there's been some studies, and certainly the sense, especially with like alcohol and drug use, that people underreport. And so they'll oftentimes tell you less than what is real, but not always. So I usually give my patients the benefit of the doubt, and I take what they say, and I go with that. The social history is going to be important, because a lot of the main chronic conditions that we're going to be talking about managing, blood pressure, diabetes, and those things, the keys to management of those conditions are change in lifestyle. And so if you don't know what the lifestyle is to begin with, then that can kind of be hard to deal with. So that's the other history: social history, past medical, past surgical, family history. Important mostly for diagnostic mysteries that might come up in the future, and knowing when to screen and to do things. First degree relatives are the most important for family history, and certainly something you want to have on the chart, have it ready, because there's going to be situations where it's going to be helpful in certainly managing the patient. So hope that's helpful. Hope you enjoyed the video, and we'll be talking more in some of the next videos about assessment and plan, differential diagnoses, and those types of things. So stay tuned.